Sickle cell disease is an inherited blood disorder. Sickle cells are not like healthy red blood cells. Healthy red blood cells are disc-shaped like the letter O and are smooth and flexible, which makes blood flow easily through the veins. However, sickle cells are crescent-shaped like the letter C and are stiff and sticky. Sickle cells also can clump together and block your child's small blood vessels, stopping them from carrying blood the right way. These blockages can stop oxygen from getting where it needs to go, causing pain and problems with how organs work. About 100,000 people in the United States have sickle cell disease. It mostly affects children of African and Caribbean ancestry, but it's also found in people with Middle Eastern, Indian, Latin American, and Mediterranean heritage. What are the different types of sickle cell disease? Everyone with sickle cell disease has at least one sickle hemoglobin gene passed down from one of their parents. There are several types of sickle cell disease. Which type your child has depends on which other unhealthy hemoglobin gene your child has inherited from the other parent. The three most common types are hemoglobin SS, hemoglobin SC, and hemoglobin S beta thalassemia. Hemoglobin SS is the most common and often the most severe form of the disease. Here, a child has two copies of the sickle hemoglobin gene, one inherited from each parent. Hemoglobin SC disease has one sickle hemoglobin gene and one hemoglobin C gene. In this form, any of the complications that happen with hemoglobin SS may still occur, but they tend to be less frequent or milder. Hemoglobin S beta thalassemia has two different forms. In both forms, a child has one sickle hemoglobin gene and one beta thalassemia gene, which results in less or no healthy adult hemoglobin. The severity of the disease depends on the amount of healthy adult hemoglobin produced. Symptoms may vary from mild to severe. What are the complications of sickle cell disease? Sickle cell disease has many different kinds of symptoms. The main one for all types of sickle cell disease is anemia, related to the rapid breakdown of the sickle cells. When you're anemic, your body doesn't have enough red blood cells moving around. It can cause delays in normal growth and development. It can also cause extreme tiredness or low energy. Another common symptom is pain. This happens when blood flow to an area of the body is blocked. Pain can occur anywhere, but most often in the bones of the arms, the legs, the chest, and the spine. In infants and toddlers, the small bones in the hands or feet can swell painfully. When sickling and blockage of blood escaping the penis occurs, it results in a painful and unwanted erection called priapism. Jaundice, yellowing of the whites of the eyes or skin, is a common symptom of sickle cell disease. The increased breakdown of red blood cells causes an increase in a chemical called bilirubin, which can lead to painful gallstones. Sickle cell disease can cause spleen damage in infancy. If the spleen doesn't work, your child is more likely to have a life-threatening bacterial infection. They'll need to take penicillin and keep their immunizations up to date to help prevent infections. Anytime your child has a fever of 101.5 degrees Fahrenheit or more, you should get help from a healthcare provider right away. Even though the spleen does not work, it can trap sickle cells, grow larger, and become painful. This is called splenic sequestration. If not treated, it can be fatal. Sickle cell disease can also affect the brain. When a group of sickle cells blocks blood vessels there, it can lead to a stroke, which is very serious. The signs of a stroke can include weakness, especially on one side of the body, slurred speech, seizure, or dizziness. If your child shows any of these signs, get help from a healthcare provider right away. Acute chest syndrome happens when a sickle cell blockage affects blood flow in the lungs. It can be life-threatening and is the main reason why people with sickle cell disease die. Research continues to improve treatment options for people with sickle cell disease. We're enthusiastic more treatments will come in time. From first conversations to treatment, Boston Children's Hospital is committed to keeping children and adolescents healthy. For more information on sickle cell disease, please speak with your primary care provider or visit bostonchildrens.org.